Hello, this is Nurse Boabi, and today he's going to show us how to use the home visiting bag, a bag used by the public health nurse during home visit rounds. It comes in 3 compartments: the first compartment, the middle compartment, and the inner compartment. The first compartment contains clean items, while the middle compartment contains items cleaner than the first compartment, and the inner compartment contains items that have been sterilized. So, let's see how to use the bag during a visit and the various compartments in the bag and the items within those compartments. During the visit, you carry the bag at your back while holding extra items like the weighing scale in another bag. So when you get to the field, after greeting the residents of the house, you ask permission to put your bag down. After the permission is granted, you have to take out your rubber Macintosh, place it on the surface before you put your bag on it. So this is how you do it. When you take the Macintosh out, you open it and the inner fold has to touch the surface. If you are putting it on the ground or on a table, any surface, the inner fold should touch it. And you should place it there closer to where you will be seated to interact with the client. So when you put it down and you're about to use it, that is after taking the data you need from the patient, and now you want to perform a particular task on the patient. Now you have to open the bag and pick the needed items. Mind you, we open the bag from the less cleaner part to the cleanest part. So you open the first compartment, take out items for hand washing. Then you have to put on your rubber apron. The rubber apron has to be worn before washing your hands so that you don't risk wetting your uniform. So this is how you wear the rubber apron, by making the inner fold touch your uniform. Then you have to wash your hands. So let's look at the skill of washing our hand. You wet your hand, apply soap, then you do the washing under running water. So the washing, you have to put your bottle inside your armpit. Mind you, there should be a hole at the bottle cover so that you don't have to open the bottle before using it, and do proper hand washing. I'm sure public health nurses, we all know how to do proper hand washing, so make sure you do proper hand washing before you start using the bag. Don't forget that by this time you would have made a lot of assessments, and you are now going to do other tasks which may be part of the assessment or part of management. Yes, so you would have taken your notebook out and pen out already, which are also part of the first chamber. We will see them. So after washing your hand, you clean it appropriately. Take note that in cleaning, one side of the towel cleans one hand, while the other side of the towel also cleans another hand. You don't use one side to clean both hands. And you should always have a rubber to receive used items like the towel. So the first chamber, you have a notebook and a pen for taking data. So before you go for a visit, you have to arrange your items right so that everything would be in the right compartment. Then you have the maternal and child book that we use to counsel. We use that as a guide when counseling antenatal or postnatal clients on how to care for themselves. So this is also a hand sanitizer that you can use during a task, but usually before any task you have to wash your hand. Yes. And then this is a towel, extra towel, different from the one you used to wash your hands. So these are the items you have in the first chamber, which is the less clean part. Now let's see what is in the second chamber, or the second compartment, which is cleaner than the first chamber. Before you pick out anything from the second compartment, you should first pick your tray so that you can put your items on it, because we don't want to scatter items. And mind you only pick things that are needed. This one, we are just showing you the various things you need in the compartment. So this is an aneroid sphere. So this one, you use it to assess all adults. That is, it's even from teenage to aged. When you meet an adult on the field, you have to assess the blood pressure. Yes, so that's how you use it. It also has the stethoscope inside. And this is a fetoscope. When you meet a pregnant woman, you have to check the heartbeat of the fetus. And this is what you will use. So you prepare for every situation. Your home visit bag has everything inside for any client you meet on the field. And this is a cord clamp. In case you meet a woman in labor, then you have a cord clamp to aid in the labor process, or you use it for anything that it will be needed for. And this is family planning commodities. For all the family planning methods, everything is there to help in counseling the client. So this one too, you offer it to people in their reproductive ages. Yes, that is from, let's say, from 13 years to 50 years for ladies. And for gentlemen, it can be above 50 years. And this is a syrup paracetamol. When you meet a child with a high temperature, then you can serve some while you refer the child to the hospital for further treatment. Then this is a manicure set. Yes, used for caring for the nails. Usually when you meet a neglected adult, neglected aged, or somebody who perhaps doesn't know how to care for the nails, then you do it for the patient and also use it to teach the client how to do it for yourself. This is a gentian violet or GV paint. You use it to treat minor wounds like abrasions. Yes, when you meet somebody with abrasions, you should be ready to dress the wound. So all these are in the second compartment. You have few medication samples like paracetamol that you can give to an adult with any form of bodily aches or high body temperature. You only give it as first aid and refer the person to the hospital. We have few antibiotics that you can use to replace somebody who is taking antibiotics and has perhaps lost it. You can use it to replace and tell them to go to the hospital. Then you have a digital thermometer. It can be digital or it can be mercurial to assess temperature. Yes, especially of children, but because you need the client's temperature for your care plan in examination situations, even if it's an adult, you have to assess the temperature. Take note. Then you have different sizes of syringes and different syringe purposes, like the insulin syringe, 5cc, 10cc, different sizes. So you use them appropriately. If you meet a client who is a diabetic and is on insulin and is having crisis, then you can use that syringe to administer the medication. It also has disposable gloves inside. This is spirit, methylated spirit. You can use it to treat minor wounds or dry wounds, sometimes CS wounds. You can use it to treat the cord of a newborn baby. This is also another hand sanitizer that you can use during a task. Yes, it's also in the second chamber. Yes, and this is a measuring tape that we use to check sinful fundal height of a pregnant woman. When you meet one, you can use it. You can also use it to check abdominal girth of adults when we are for different purposes. Yes. Let's see what else is in the second compartment. This is a crib bandage. Yes, to treat minor injuries, like injury, like pains in the knees, some sprains. If anything, you use it to treat as first aid while you refer the client to the hospital for further treatment, or you use it to teach a client how to bandage, yes, in the house. Then we have an adhesive plaster, also to treat minor wounds while you refer the client for further treatment. Don't forget, we are not there to provide hospital services. We are there to give primary care to the client. our client goes for further treatment. And this is a padded spatula. It should be in a rubber. You use it for various purposes depending on the client that you meet. For instance, you can use it to assess the throat. Yes, you can, by using it to press the tongue down while you assess the throat, depending on the client's complaints. This is a weighing bag in case you meet a baby and you have to weigh the baby and you have the scale for hanging, then you use it. If you are taking note, you see that most of the things in the second compartment are items, specific items for specific clients that you will meet. This is a sterile glove in its pack, so it's not, the outside is not sterile. So this one you use it if you have to dress somebody's wound or you have to do any sterile procedure, then you have to take it out and use. Yes, we all know how to use a sterile glove and how to wear it. I have a video on that, so you can go and watch how to wear it. Very simple way of wearing it. And these are cotton wool swabs. Yes, also you use it when you need it for wound dressing, for cleaning the cord. For wound dressing, it has to be sterilized, but once it is here, you don't need it. But for cleaning the cord, if you need it for wound dressing, then it should be sterilized and placed in the sterile compartment. Yeah. So those are the items for the second compartment. Make sure you have all these items in your home visit bag before you embark on the bag. Please, for examination situations, when you are taking somebody's bag, check that everything is inside before you use it. And you don't bring all these things out when you get to the food. You bring the ones you need for that client. You don't take everything. So if you don't need nail care, you don't bring the manicure set out. You only pick the items that you need.